With that, basically after surgery, a couple things that threw me off guard were the amount of swelling that I had in my body. So with anesthesia, with all the things that they pump into you, with the trauma from the surgery itself, um, just everything, I was so swollen, and that was not really, I didn't expect that because I had never gone through major surgery before. I had had some things come up, but nothing like that. That was something that was really shocking to me. Like, for me, being like a physique competitor, I'm pretty familiar with my body and the way it functions and my body type. And for me, like I couldn't put on normal shoes, so that's something to think about. Like you don't want to have shoes where you have to tie your shoes because you can't bend over after surgery. I couldn't even put on normal shoes, so I had to wear slippers. Um, my torso was like everything was like a sausage. Like definition anywhere was non-existent. My legs like blended into my knees and my ankles. So it was just kind of shocking, only for the fact that I was really amazed that my body was able to be that way, or that's how it reacted after surgery. And that swelling did not go down for several weeks. Like well after the surgery, after I drove back into town, I was still super swollen. So that's just something to remember that, I feel like that's a big part where your nutrition comes into play, and then just making sure that you're on a regimen where you're giving your body everything it needs to recover properly, because obviously it's pretty traumatized, and my body really like I thought, I was gonna get rid of the swelling pretty quickly, but I stayed really swollen for a long time. Um, so, anyways, that was something that shocked me. And then, of course, just being very cautious with drugs, prescription medications, and stuff. For me, I didn't have any issues with being addicted or anything to the prescription medications. Obviously you feel very good on them, and they help a lot with recovery, in my opinion. I think it's great to be able to put yourself through that pain-free environment so that your body can focus on recovering, instead of just sitting in the pain all the time. I know that's a thing for a lot of people is sometimes people will choose not to have pain medications, but for me, as far as the swelling goes, and just purely putting yourself in an environment where you can take that pain away so that your body can kind of relax and function, as if it was more normal, so that recovery can kind of happen at a normal rate. I don't know. I think that's something that I've always felt. Is there's a small period of time where prescription medication is very important, and then you want to make sure that you're obviously taking yourself off of that or weaning yourself off of that at a decent rate, whatever works for you and the amount of pain that you're in. So, because that was a big thing for me, I did not know what was going to happen with the prescription medications and then my surgery, because it's very common that people get hooked to their medications just purely because they are on this regimen, and you're in so much pain, and then it's just this bad cycle. So that was not the case for me, although I could see how that could be the case for other people. So just something to think about when you are choosing surgery. So another big thing was that, because they didn't put rods in, or because they didn't fuse my back, the only reason that they went with that, was because I had muscles that were already built up in my spine enough to where, after surgery my spine would be able to still be supported. So that's also something to think about. If you are far enough away from your surgery, I would, as long as you can, if it's not super painful, um, or figure out a way to where you can do some pre-surgery physical therapy. A lot of times people take that for granted and use it kind of like as something to blow off. But in my opinion, for different surgeries, it's very important to have that strength leading up to the surgery. And for me, I just got so lucky that I had a lot of muscles around my back already built up. So it ended up being very beneficial for me. So if you can do that for whatever surgery you're going through, I think it's a very big deal. Some people do not agree with that, or they think it's not necessary, but I definitely do. Um, so some things that they told me after my surgery was they wanted me to stay away from deadlifts for quite a long time. That was not going to be a movement that was in my regimen. Um, and I guess that kind of leads me more to now, like where I am today. Um, with deadlifts, with that movement specifically, that was not a movement that caused me problems getting back into the swing of things. Um, so it's one of those things where um, I have found more issues actually with an overhead movement, with the stability of the entirety of my spine, versus just like my low back region. I think that they were pretty concerned about, uh, the deadlift movement just being predominantly low back. So just things to be cautious of, things that they recommend might not be what's weak for you, but just something to pay attention to. Let's see, where should I start? So after surgery, let me pull up actually a message. With surgery, I was not able to push pull. I wasn't able to pick up a coffee cup. I wasn't able to hold a purse. I wasn't able to have a rotation in my thoracic spine. Um, they wanted me to do absolutely nothing except for walk after my surgery. And then, because I didn't really remember the details right away, but I looked into some of my messages. And in one email, I had put um, that they did not want me to round my back for like at least 42 days, 42, 45 days, no rounding or curve in my back at all. Um, so for a very long time, I think it was like there was like 4 to 6 weeks where I absolutely could not touch anything. Like I could only pretty much like brush my teeth barely and walk. And then I think 6 weeks after that, I was able to do like 5 pounds per arm was what they required. And then after that, I'm trying to think, I think I was able to do swimming only, and some physical therapy. Um, so it was a very, very slow process, and I believe that it was more like in the 6 week increments as far as what I was able to handle. But originally, the first 6 weeks, absolutely nothing. But something too that was a question for me when I first was going to get the surgery was if I had to wear a back brace. Um, for my case, I did not have to have a back brace on, and I don't know if that's going to be the case for everybody. So that's just something to look into, because having a back brace is a whole heck of a lot worse. But so let's see here. Um, so basically, because what they said I could only do was walk, I basically walked every day, and I put that into my regimen. So a big thing for me was obviously nutrition and walking. Um, with my job and kind of my lifestyle, I knew I was going to lose a ton of muscle, which I absolutely did. I atrophied in a lot of places. Um, it was very, very, very difficult getting back into, you know, picking anything up, after. um, 6 weeks or 12 weeks, whatever. And but I tried to walk as properly as I could. A big thing for me during this time was I spent a lot of time doing corrective things because my whole spine had been thrown off due to that the bone being in there and articulating with my hip. Everything shifted, so I did a lot of corrective walking. So I made sure that my gait was proper, my toes and heels were in proper location. Um, Stuff like that was a big thing for me, and that was kind of the way that I was able to stay sane through taking however many months off. Um, so I walked and I really honed in on my nutrition so that I didn't gain a whole lot of weight during this time. I stayed pretty much very, very level throughout the entirety of my surgery. So that was a very big deal. And a lot of times, the foods that you eat can help with recovery and things. So that's just something to think about too. Um, Although there was a time where, in this whole grand scheme of things, I did have someone kind of pep talk me in a way where I didn't take. There was a period of time after the surgery where I realized how serious surgery was and how significant it was to make sure that I was being safe with my body, and not pushing the limit as much, and just listening to the doctor and what they prescribed, because basically like what they told me was like, don't mess it up because you went in and you had this corrective surgery, and sometimes the actions that you do after surgery can make it all worse and ruin it. Like the surgery won't be worth it anymore. So it's something where I would just say really listen to what your doctor has to say, and if you have specific questions, ask specific questions. Like I asked, when can I move around this much weight? When can I do this specific movement? When can I get into the pool and swim? Like what kind of swimming can I do? Um, so I would say that's a big thing because um, you don't realize how much how much energy your body is putting into fixing this trauma of surgery. So it's very easy to say, oh, I can do that, and then you just pick up a weight or whatever, and there's a lot of long-term damage that you can do that you just really don't realize. So I stress that only because it's a very truth statement, and also a lot of times people will not go through physical therapy, or not do physical therapy exercises because they assume that they're fine or they feel fine at that time. But if your body is not making the connections that you need to be making through physical therapy, or certain orders that your doctor has for you, those are very, very crucial because during this healing process, that's what your body is supposed to be doing. So just some things to think about that were kind of on my list of things with surgery. Another like really funny side note is that the bed that you choose to sleep in after surgery is very important. I was in an Airbnb that I didn't know what kind of bed I was going to be in, but sleeping was horrible. I was in a ton of pain. The bed sucked, the pillows sucked, everything was bad. So that was pretty rough. I didn't think about that. And so it's just something to think about because you want to be as comfortable as possible, definitely. And I actually went out and purchased a ton of different clothing, a ton of different shoes and things that were going to be easy for me after surgery. So like things I could just slip on and slip off, or didn't have to mess with anything. So all stuff I didn't think about until I started really looking into it. Um, so I guess more so, let me see. There was a few things. Let's see here. So I kind of wanted to read, it's a little bit more personalized, but I kind of wanted to read some of the text messages I found because my memory is just so bad where I forgot about a lot of this stuff. But it kind of leads me up to where I'm at now. Let's see here. So this email I basically sent to Richard, who was my mediator for the surgery, and this was past. I wish I had a date on there. It was somewhere in December. So I had my surgery October the 15th, and this was in December at some point. And I said, and I think it was late December. So the email says, I began introducing movement into my body again this past week, and it was nerve-wracking at first because I hadn't rounded my back for 42 days. I'm so thankful. No pain in the areas I had pain in the past, only instability, which is understandable. I will be attending physical therapy and have been bracing my back to train other muscle groups safely. I have a feeling I'll be coming back with a vengeance, but pacing myself very much. I also believe I had mentioned to you my gastrointestinal self-study. I truly believe that my GI system has improved post-surgery due to the relief of the nerve compression and pain with the L5-S1 region, a significant difference post-operation. I'm happy to say that the business is doing well even with the surgery, blah, blah, blah. That was when I was opening my first gym, and that was just kind of a side note. Blah, blah. Yep, and just how freaking grateful I was for him. Yeah, I said I'm eternally grateful because I am able to pursue some big endeavors without my body working against me. And that's a very, very true statement. There was a lot of things that I couldn't do because of my back. So with that, it looks like in December, I feel for me as a young person who was already trained before surgery, and then I was in a very, very good position while, at this time in my life for surgery. I believe I began doing some training with my back braced in December, which I wasn't cleared to do that until March or April of 2020. So doing that was my own choice because I felt very comfortable. That's my job, is to make sure that you're doing movement safely with correct form. And for me, I felt like I was in a place where I could monitor that, which I do not maybe recommend for everybody, because if you are unsure, I would not risk it. I would just wait until they clear you. But of course, it's completely up to you. So I have a couple other messages, blah, blah, blah. Okay, so this message was from the day after surgery. This was to my pain management doctor. He's fantastic. That was Dr. Baker from Nova Spine Pain Institute in Phoenix. He was asking about my surgery, and I said surgery went very well. The resection was beautiful and quite shocking that it's finally out of there. I'm in a world of hurt, but am glad I got to take my first shower today. So I think that was 1 or 2 days after the surgery, 2 days after the surgery. And then very glad I had tramadol left over because oxy doesn't do much for me. So that was one thing that I realized, like I could take a ton of oxy and I would have no pain relief. But tramadol was what helped me the most. And I think that's just different for everybody. And then the doctor said, that's great that tramadol works for you. It's safer than Percocet and way less likely to have an addictive potential. So that's something really good to know. Tramadol was what worked, and it was less addictive. That's that. I'm gonna check in. Okay. So another message to that doctor and Dr. Baker, I said, I wanted to check in post back surgery. It's been 4 months since the procedure. I'm training again, almost back to normal. Muscle mass is coming back significantly. There are a few main lifts that are There are a few main lifts that still aren't as heavy, but I'm feeling great overall. Hoping to compete again this year. The scar is not very pretty. Awesome. Yeah. So basically, 4 months after the procedure, so I was getting back to normal in December, and I had spent time walking all the way up until then. January, February, and March. January, I was pretty much probably about 80% normal. February and March, come March, I basically put myself on a strength training program from January, February, and March. Once March rolled around, I felt pretty comfortable with movement and lifting and weight and all of that stuff. So I felt pretty good then. In recent days, I have been doing some high intensity movements. I've been throwing some things around. So I've had really no issues at all. I've gained a ton of my muscle back. I'm pretty happy with the muscle that I've gained in my low body because that was something that I was never really able to train properly before, just because of pain reasons. So being able to train that now more normally is great, and I'm seeing a ton of muscle mass being put on there. Um, and then something though in the recent days, and that's kind of why I'm glad that this video is happening now, because I think if I would have done it about a month or so ago, I would have said, yeah, surgery was great, no complications at all, everything is perfect, yeah. So these days, what I've been playing a lot with with a variety of different types of exercise. So, for instance, the other day, I played a full day of sand volleyball, which was pretty high intensity, a lot of vertical jump, a lot of like impact kind of stuff. And about halfway through the day, I started to realize that my back was pretty unstable, which I hadn't had any issues ever since like March, or even January, I could say. January, February, March, I really didn't have any issues. And then just now, it's May, and I'm starting to see that I do have some instability in different parts of my spine. And frankly, it was kind of like a few days where I felt really unstable. So that day, about halfway through the day, I started to feel the instability in my back. And then I continued to play. And then by the end of the day, my back was just shot. So the few days after that, it started to progress progressively better each day. But then I had gone out and done some things, and it just made it worse again. So that was kind of my own fault, because I think that, say if while I was playing volleyball, if I would have thrown a brace on, I think I would have been fine. And that's kind of the way that I've functioned now is if I feel any sort of instability in my back, even before then, I would just throw on a brace, or if I was doing like crazy high rep stuff or anything significantly heavy since surgery, I would just make sure I'm braced before I try it without a brace. So I think if I would have braced, I would have been fine. Although right now I'm still kind of recovering from that. So I do have some pain in my back. Although what I was expecting was I was gonna, have pain in that lumbar region and more so to my left side. Um, but where I'm feeling pain is my mid back, and instead of anything where it's like an extremely sharp pain or anything like that, the instability, it kind of feels like my back would be able to bend backwards more easily than it typically would. Like the muscle groups would kind of just give out and it would just kind of fall backwards. And then after that feeling, I kind of get a very dull sensation that kind of just sticks with me. So, and that I feel that more significantly on my left side, but still in that mid back region. So, what I am expecting is happening is I expect that over time, you know, with ice and heat, that it'll just slowly kind of recover from that, and I can get back to strengthening it. But what it seems to have happened was I've been strengthening my spine and it's been going very well. Just the amount of activity I did had kind of hurt in that area, because I believe that in my spine that might be just a part of weakness, you know, from the surgery and then from just continuing to build up that strength in my back. I think that was just kind of a weak spot for me, and it's really coming out. So I'm really hoping that it would be something where I can strengthen it now that I know that it's there. So I think over the next few weeks, few months, I'm going to spend strengthening that kind of midsection of my back. So that will be interesting. I'll see if it can come back and if it can support my normal activity again, normal weight. I've been trying to be real cautious with it. So just something to think about, because I thought, man, after surgery, you know, my spine, my back muscles are able to fully support my back, which they completely are, and they are able to under a very heavy load. They're able to move through a lot of movement. But I do realize that that high intensity kind of full day kind of overdid it. So that was something I did not realize was going to be the case. So that's where I'm at now. I'm sure that it'll be fine and be back to normal. And then if it's not, I'll kind of address the issues as they come. But basically, that is it in a nutshell. I've tried to really dive deep into some details. Actually, a detail with surgery, I know that this is kind of like out of context in the video. I probably should have mentioned this at the beginning when I was talking about insurance stuff. Something that came up when I was scheduling my surgery, there was an issue because when you are scheduling a surgery, you want to make sure that your insurance is going to cover the entirety of the surgery. Something that happens actually quite commonly is the anesthesiologist is sometimes this separate entity where they don't get covered underneath the same umbrella. So for me, the way it was explained was the day before my surgery, they were to choose an anesthesiologist that was from this list, and they can only check the day before to see if that anesthesiologist is covered under that insurance. So it's kind of a weird thing because, you know, you want to have all your ducks in a row before you go into surgery and have to pay out all of this money, and insurance pays all this money. So that was kind of unsettling at first because we were really pushing to see, you know, if my anesthesiologist was going to be covered, because that could have been, you know, $15,000, 20, 30, 40, you know, however much it would have come to, just purely because that anesthesiologist wasn't under my insurance. So that ended up getting figured out. Although I'm not sure if all of the you know, if a lot of surgery centers run that way, but in this case, they picked the day before, and you just don't know until you know. And I think that if you were to continue to push and push and push like we did, you could probably get some answers. But it was kind of a very weird runaround. So just don't get caught off guard by that, and don't let that fall to the wayside, because you might have a giant bill to pay after your surgery that you weren't expecting. Yeah, so basically, let's see here. Long day, high intensity, yeah. So yeah, to kind of just go through with all that, I also realized that with my training too, like I explained before, I think overhead movement causes me more issues than, like, for say a deadlift causes issues. So that's just for me specifically, and I think that has to do with a lot of that main spine instability, because basically going overhead, you're really having to engage the entirety of your spine. So it just causes me more problems, but that's just something for me to build up strength and work on. So yeah, I mean, I tried to write down everything I could think of, although I really, have a hard time remembering all this stuff, especially with it being a little while back. But there were actually a few questions that some people had asked me on YouTube. So let me just try to address those really quick. If you are still watching this long video, then good on you. But if you're not, then I do not blame you at all. So someone had said, I have sacralization on right side L5-S1, but I have experienced pain in the left side. Is this normal or different than yours? So with that, before surgery, I had most of my pain on my left side L5-S1, and that's where my sacralization was on the left side. So having pain on the right side that's maybe a little different than mine, although now after surgery, having trained both sides of my back, I have realized that the right side of my back is weaker than my left side because of that bone being there. I had built up more muscle on my left side, and it's pretty significant. Like you can see it aesthetically. And I can very clearly tell that my right side back is a whole lot weaker than my left side back. So I do have a little bit of like burn and pain on that right side occasionally, but that is post-surgery. I don't recall a whole heck of a lot of pain before surgery. So let's see here. I want to see if there's any other questions I can answer. Any update on post-surgical intervention? That's what my video is about. 16, please post a video of surgery. How's pain after surgery? Right now I have zero pain. Just kind of dealing with that mid-back stuff, but I am pain-free. I would say there were several weeks after surgery where I dealt with pain, but for the most part, after the swelling and trauma and all that stuff had gone down, I am doing okay, and I was pretty pain-free, a lot faster than I expected, for sure. And blah 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 blah. Yeah, blah blah. Yeah, it does fucking blow. That's true. Then there was blah blah. Okay, got it. I would say if you're a young person and you are dealing with this kind of stuff, go get the surgery done. It's just not worth it. If you're an older person and you're wanting to go through this surgery, I think recovery might be a bit harder. I would say if you're a young person, do everything you can to prepare yourself for a successful recovery. And I would say it's probably the best way. But of course, I think that's dependent on each case and how big your enlargement is, and also the amount of sacralization that is taking place. Yeah, that's so sad. I'm reading through these, barely walk. Yeah. I'm sorry. Makes me so sad to hear all of the people that are dealing with this. Saw the bones, said no, kills the nerves. Ibuprofen do not work. Oh, that's actually something interesting. Very side note is before I had surgery, I was dealing with a ton of pain, and there was not a whole lot that could take it away. I did a lot of TENS unit stuff, which is that shock electrotherapy. And basically, I just picked up a little TENS unit from the CVS, and you just stick it on the area, and it sends your electroshock waves into your body, and it's pretty painless, but it stimulates that area. So I just found that if I was having to sit in the car for a long time, I would throw that on and it would help a little bit. and it just made me feel better. It didn't really do anything, and it didn't really take some of the pain away, but it just, at least I was doing something. Um, and also too, I got to the point where I couldn't really sit down and eat food, or like if someone asked me to go to lunch, I would say no because I couldn't sit through the entirety of the lunch, just because sitting really it was painful. So what I ended up doing was I did a topical CBD oil on that area, and I shouldn't say it took the pain away. It took some of the sensation away to where I was able to sit through lunch, but then immediately, like after 45 minutes or whatever, I just really, it came back. So um, I would say, okay, so that's in that same breath. My question is did it ever affect your nerves to your legs? And did you get piercing headaches for only minutes at a time? So so the times when I got headaches was after my spinal injection with the possible NSF leak. I had horrible migraines because I believe there was some issues there. But I don't remember any piercing headaches purely because of the articulation. Um, and then as far as the nerves to my legs, so a lot of times people, with the sciatica have issues. Um, so my thing with that is an articulation could potentially affect, nerves to your legs, causing that tingling or numbness. Something too might be the pain from my articulation caused a lot of dysfunction in my body, meaning I walked differently, I trained differently, I did a lot of things differently, which can cause me to use my body to where it could affect my sciatic nerve. Um, not saying the articulation itself would necessarily do that, but I remember just having other issues because of the pain of my back. It forced me to do things differently, so that could potentially affect some of the things, some of the nerve groupings that go down into your legs. So that might be what's going on. But I didn't necessarily have a whole significant amount of numbness or tingling in my legs. Um, let's see here. Sorry, this part of it is so long. I've been dealing with speed recovery. Thank you. Certain workouts. Yeah, if you guys want different workouts that I did to help train during the time I had this going on, and that's something that I can definitely help you with. If that's a thing that you're looking for, just let me know. Because there were things I was able to do that still worked my muscle groups, but took some of the pain out of the equation. So that's definitely something that's a good question. There are things out there that you can do that still train without necessarily affecting that area. When is your surgery? My surgery was October the 15th. Yeah, so let's see here. I'm gonna see if I had a couple other questions, and I just want to make sure I address them before I sign off. So if you are watching this video and you want to keep up to date with all my training and stuff, I own All Athletes Welcome Gym. We're a gym located out of Prescott, Arizona. You can find us on Facebook and Instagram. And that's where a lot of you guys have reached out. So there's that. Let me just make sure here. If I didn't answer your question, please let me know, and I will certainly do the best I can. Let's see. Okay, nope, it looks like that's it for right now. So there's that, you guys. Sorry this video is so long, but I just don't know how else to do it because it was, it's a lot of information, and for me it was a lot of information to do a lot of self-research for when I first figured out what I had. So I'm hoping that this helps. Again, you can find me on Instagram and Facebook under All Athletes Welcome Gym. And if you can't find me there, MJ Stock, that is me. So feel free to reach out however you feel necessary, and I will try to help you the best I can. So, all right, you guys, well, thanks for listening. Bye.